Pleasure to introduce Dr. Robert Langer and Dr. James Kenyon to the university to talk about the Mountain West CTR-IN that we're all a part of. The University of Montana is a player in that. There's about 11 institutions and we've got about 13 of them. Somebody will tell us more about that. Let me give the blurb. Actually, Bob's up there, but I'll read it anyway since I printed it out. Bob's the Principal Investigator for the Mountain West CTR-IN proposal, and James is the Jim is the Program Coordinator for the CTR-IN. Bob's a research professor in the School of Allied Health Sciences and professor in the Department of Family Medicine at UNLV. He's also the Associate Dean for Clinical and Translational Research at the Department of Family Medicine at UNLV. And that's some kind of a foot in the door over in Reno as well, but I don't know if you're going to talk about that. Jim is the Program Coordinator at CTR-IN. As I said, he's a professor in the Department of Physiology and Cell Biology and at the University of Nevada School of Medicine. He's also their Senior Associate Dean for Research. So, I know what they have to tell us. Thank you.
Thank you, Scott. Thanks, everybody, for coming. We've got some really interesting stuff, I think, to tell you about. Some tremendous resources that we're fortunate to have in the Clinical Translational Research Infrastructure Network, which is otherwise a mouthful, so we call it the CTR-IN, that serves the Mountain West. And just to clear the air, so I'm the only one, I think, in the state of Nevada crazy enough to be double appointed at both universities. And so I work for Jim over on the medical school side. Our medical school is based out of Reno. Jim's the Senior Associate Dean for Research at UNR School of Medicine, and I'm the Associate Dean for Clinical and Translational Research under Jim there. And then at UNLV, I'm a research professor, and that's where we host the CTR-IN. So I've got a foot on both sides of the state. The program, though, is aptly hosted at UNLV, but with strong collaboration with UNR, and in fact, really strong collaboration across the entire Mountain West region of 7 states and 13 institutional partners. And it's a NIH, actually under the IDEA program, National Institute of General Medical Sciences program, that is intended to help grow translational and clinical research across the Mountain West, where we've traditionally been much stronger in basic science, and really to help us move into domains that we certainly have lots of need for, and our populations have lots of need for. So it's a $20 million 5-year grant from the NIH, and as I said, 13 universities across the 7 IDEA states in the Mountain West region as defined by IDEA, and started with the foundation of the Mountain West Research Consortium, which was formed in 2009 as the University of New Mexico at Albuquerque was pulling together their proposal for a clinical translational research center. And again, my colleague Jim, along with Richard Larson, the PI for that center in Albuquerque, put together the Mountain West Research Consortium as a way of the UNM CTSA serving the region and being much more than a local enterprise, something again to fill the need that was already quite clear across the Mountain West. So the 7 states involved in alphabetical order are Alaska, Hawaii, Idaho, Montana, Nevada, New Mexico, and Wyoming. And overall, our mission is to foster clinical and translational research, or CTR, according to NIH definitions, and to provide core resources to facilitate the development of researchers moving into clinical and translational research, essentially to bootstrap CTR across the Mountain West. And in essence, we will sink or swim based on the increase in our level or equivalent translational and clinical research that we can grow across the region in these next 4 years before it comes time for our renewal, which we're already thinking about. In fact, we started thinking about it before we even got the notice of award. That's the way that these things go. But in essence, what we need to show is a meaningful increase in translational and clinical research across the region. Now, some might say that that's relatively easy for us since we started out from almost nil, On the other hand, it still has to be a meaningful increase, and we're really quite optimistic given the way that we've started this first year now. We're just 14 months into the program as of now. I think we've got lots of seeds growing very well, including some in this room. So another way of looking at it is that we want to be a rising tide that lifts all ships. And that's important to explain in this context because, again, we're across 7 states and 13 institutions, and every one of them is unique, which is one of the reasons that we're here. Jim and I are visiting all of the partners in the consortium. We're doing that essentially on a yearly basis for now to really understand context and environment and to try and understand how best we can work with people at each institution with their own distribution of schools and colleges and departments and areas of strength and areas of weakness that can potentially be filled by partnership with others. And as part of that, we realized that there are going to be some places that would potentially be stronger in terms of their applications for our support. And we're trying to be democratic in that. So in essence, what we're saying is we're looking for the best translational and clinical research at each of the 13 partners across the consortium. We're not going to leave anybody out in the cold. You've had some incredibly strong applications here at UM. Other people haven't necessarily been quite as good, and we're trying to bring them up. But this is really a consortium, and it's something where we are all ultimately going to benefit by the kinds of collaborations and the ways that we can help one another move forward. So one of the things that we're also learning at these visits is the shared areas of interest across the region, some of which were not at all obvious when we first wrote the proposal. Traumatic brain injury is a good example of that, where that wasn't even a blip on the radar when we wrote the proposal a couple of years ago, but now we're realizing that almost every research university in the consortium has something going on in TBI. Obesity research, nutrition related to obesity, nutrition related to preservation of muscle mass with weight loss, are other common themes that are starting to come up. So part of what we're trying to do is help the region grow by plugging people in together and providing some collaborative opportunities across the region as well. We want everybody to grow in the funding environment that we're able to provide. So who's in it specifically? UNLV is the host. University of Nevada, Reno with the School of Medicine, also very much engaged in Nevada. The 2 campuses, Anchorage and Fairbanks in Alaska, Hawaii, the main health sciences campus at Honolulu, Manoa, Boise State, Idaho State in Pocatello, University of Idaho in Moscow, your sister Montana State down the road in Bozeman, you folks, New Mexico State University, all the way down in Las Cruces, University of New Mexico in Albuquerque, and University of Wyoming at Laramie. What will it do? Well, in terms of concrete support, we have pilot grants as our flagship. That's by no means the only means of support and the only resources that we offer, but that's what gets people's attention first because it's the most money. Anything from $40,000 to $75,000 in direct costs per year. Also, mini-sabbatical and visiting scholar awards, essentially to develop mentoring and other research collaborations to help people grow in their careers or to transition in their career from something that they may have been doing perhaps at the bench that can then move into translational or to clinical work. This is an opportunity that's really worth talking about right now because we currently have an RFA out for mini-sabbaticals and visiting scholars, actually 2 separate RFAs. I can show you on our website later if we have time where you can access all this information. But those RFAs are open just until November 26th, so coming up real soon now. And I can tell you so far we've had very little interest in those things. And last year, these were the absolute perfect grant opportunity. There was a 100% funding rate for the applications we received last year. That doesn't happen very often. So, and again, so far the applications have been sparse. Now, visiting scholars are for people who are typically in early career stages who want to develop a stronger relationship with a mentor, potentially spend some time in somebody else's lab someplace else, or even here if you need that kind of release time. And these are awards of between $8,000 and $10,000 in direct costs that can be used for travel, for lodging, for some lab supplies for the mentor, and basically as a way to help build that relationship earlier in a research career. A mini-sabbatical isn't necessarily a sabbatical in the classic sense. It's an award for somebody who's mid-career or senior, who is looking to move into a new area of research. It could be moving from the bench into something translational. It could still be moving from something translational or clinical into an entirely new area of research for that person. We're spending some time with a collaborator someplace else, developing a stronger relationship, maybe learning some new lab skills or some new investigational skills would help move their career in that direction. The mini-sabbaticals are for up to $20,000 in direct costs. We anticipate funding 4 of each of those in this cycle. And again, the odds are currently looking pretty good. So just note to self, November 26th is the day that those things close. Mini grants, something that we added in this second year of the program. One of the things that we learned as we were visiting partner institutions relatively early on is that the pilot grants were already quite competitive. And so I'll show you later what the statistics have been on the pilot grants. But we had many people who had really good ideas who just did not quite make the cut in pilot grants, but still had some ideas that should have been funded and some things that could be tested potentially for less than $75,000. And in fact, as we were talking to people at some of the other partners, we realized that lots of people who had research interests were fairly inventive in the ways that they were able to test their ideas. They wanted to do a community intervention in exercise, for example. They would find a way to get a community grant for $3,000 and to get their dean to kick in another $2,000 and to get some community organization to then put them over the top with another $1,500. And for under $10,000, they would be able to do a pilot to test something. So we figured with that, if we could put together a pot where we would have roughly about $10,000 for those sorts of tests for people to move some of these good ideas to see whether or not they actually were viable, maybe to get a publication out of that and start in that direction. Maybe we could grow some more seeds across the region. So we implemented that this year. We have 2 calls for that, as I'll show you later. The first call closed a couple of weeks ago. We got 26 applications for that. There's going to be a second call closing on January 14th. And again, that's for people who have some ideas that can be tested for a lesser amount of money that may keep them moving on a path towards developing something that would be more substantial. And last but not least, providing infrastructure and services through what are called key component activities, essentially cores, where these resources are available to all faculty at all 13 of our partner institutions, regardless of whether you have any funding from us, any other interaction with us. And I'll go through what those resources are. But it's really important that you understand that you don't have to be getting a check in the mail from us in order to access the services that we're providing as core resources. Funding preference. Early in the program, we decided that it would take a little bit longer for people who were new investigators, either early in their career or new investigators under the NIH definition, because those folks really don't understand how to get a R-level grant written, whereas people who've been successful as basic scientists and had some NIH funding won't take quite as long to move to a level where they could be successful in funding. So in these first 2 years, we've had a preference for people who were early career or new investigators by the NIH definitions, just because we thought those folks would need more of a running start to get up to speed to where we want them to be funded by the end of our first 5-year funding cycle. Also very interested in supporting established investigators moving from bench to translational or clinical. Again, we think that those people may be able to move with less lead time. And very importantly, projects focused on health issues relevant to our region, including those in rural and vulnerable populations. This is another really key thing for us. Our other peer CTRs are in urban areas, places that are not quite as well funded as Baltimore, Boston, and San Francisco, but still places that have fairly substantial research enterprises where the populations and health issues in the regions have been studied. Not so in the Mountain West. Our populations are grossly understudied, even our Caucasian populations, for some of the disease risks that are more unique to our sparsely populated region. Things like access to health care, which is a huge issue for us in this region and doesn't exist anything like this in the rest of the United States. We certainly have other vulnerable populations, Native Americans, Native Alaskans, Native Hawaiians, who are quite unique, and you certainly know here as well as we do what the issues are in studying those populations in an effective way that's sensitive to their needs and to their culture and understanding of health, which we can all learn from. It's another thing that our region can actually contribute overall to the knowledge of health, understanding that the traditional Western view of disease and Western view of diet and exercise and everything else isn't the only way to go, and that may not necessarily be the way that the body is calibrated. So we're very keen on funding things that will be unique to our region that can also contribute to a general understanding of health that would be useful for other populations. We, by design, are using an NIH-style approach to our applications and funding. That's because, again, our mission is ultimately to help folks in the region become successful at that level. It doesn't have to be NIH. It could be American Heart Association, American Diabetes Association, American Cancer Society. But those of you who know that drill in research know that they're all quite similar. And what we're trying to do is help people that we are going to support learn how to be successful in writing those kinds of grant applications and doing those kinds of budgets and the IRB and all the other stuff that goes along with it. And model the processes that folks need to understand in order to compete successfully with the big boys and girls from the Baltimores and San Franciscos and San Diegos and the other places that you're going to be competing with when you get to the point of putting in that R01 application. So our key component activities. We've got education, mentoring, and career development, also known as CREMCAD, an odd kind of an acronym, clinical research, education, mentoring, and career development. Key component activities, so that's a mouthful, but just think of it as education and mentoring. And within that, we have a separate education unit and a mentoring unit. Craig Mogard, here in the room, you all know, is one of the co-directors of the educational piece. And those of you who know Craig's work know that he's been quite active in online education and public health. And so some of our offerings are along that line. We have a mix of taped lectures and other course material that we're developing that is available through a portal on our website. Some of this will ultimately be certificate programs and other areas where you can actually document your participation in the educational activity. But really the goal is to help people who need to fill in some of their knowledge, some of their research skills in order to move forward in a career in clinical or translational research can get that asynchronously through our website. Mentoring is the other main unit in that KCA. That's co-directed by Pope Mosley at New Mexico and Bruce Shiramazu at Hawaii, both of whom are highly experienced mentors themselves. They're not doing the mentoring because they would be overwhelmed, but they are helping people either to supervise mentoring relationships or to find a mentor if you don't have one. And again, I can't emphasize enough, all of this stuff is available to you regardless of whether you're getting any other support from us. So if you feel like you need a mentor, even if it's not in your mainstream discipline, but in some other area that's going to help you move further into clinical or translational research, call on these guys and they can help you find somebody to link up with. Generally, that will be at some other place within the Mountain West. We have some tools available that I can also show you on our website to help find a mentor. All of our universities are now up on the Vivo academic profile system. You folks are up on that now. It's a very searchable system where you can look by keyword, titles, all kinds of other things, and find somebody who may have the skill set that you're interested in linking up with. Next KCA is study design and biostatistics. This is also really key. We understand implicitly that in order to be successful in this area of research, you need to understand how to do sample size and power calculations. You need to have a sound study design that's going to pass muster in peer review. And so these folks are actually there to help do that for free. We fund a 20% time biostatistician at each of our partner institutions. Solomon Harar is your designated person here, so he's funded by us 1 day a week to help with this kind of work. And that means also when you put in a pilot grant or a mini grant with us, if you need statistical help on that, then Solomon can be built into that, again, at no cost to the grant. So very important, and that should be one of your first calls when you're thinking about designing a project. And then we have the pilot grant key component activity, and very pleased to say that that's actually housed here. Curtis Noonan is our director for that and has done just an amazing job. I've nominated him for sainthood. I don't know when it's going to come through, but the pilot grant KCA is really our unit that, again, is most visible in terms of this kind of support. And I'll show you again when we get to the website the list of pilot grants that we've got already. So far, in just 14 months, we have funded 35 pilot grants. Funded 35 pilot grants. That's not even beginning to look at the iceberg of all of the pilot grants that we've reviewed and all of the contacts that Curtis and Bill Shuttleworth from New Mexico, his co-director, have helped through the ropes here. So pilot grants, again, a very important, probably the most visible program, but by no means the only way that we can help. And then we've got the administrative KCA that I lead, which besides doing all of the main administrative stuff that you would think about, also provides editorial support for people within the region to help get manuscripts published, to help get grants polished to go in. We'll be providing mock study section help, and we also run our annual meeting, which is a really big event that we'll talk about in a couple of minutes. Okay, all of these services, as I said, and I'm going to sound like a broken record, but it's really important that you understand because we're not getting people to utilize it as much as we would like people to utilize the services. All of this stuff, education, mentoring, study design, biostat, the annual meeting, is available to everybody in the region no matter what, just because you happen to be a member of the faculty at one of our 13 consortium institutions. Please use us. Okay, besides that, we have an annual meeting. So I'm fond of saying that we cover 1/3 of the US landmass and 4 time zones. That's our mission. So we are virtual 365, 24/7 through our website, and it's pretty robust. But I'm a real strong believer in FaceTime, another reason that we're out here to meet with you folks. And I think that a huge amount gets done when you make eye contact with somebody and you start talking about shared research interests, or you start understanding that this person has some knowledge that can actually help your project move forward, even though they're in an entirely different discipline. So once a year, we get together face-to-face for an annual meeting, and that was held last June in Las Vegas. It's going to be again in Las Vegas this year. The original concept was that we would move it around across our 13 campuses. Not sure that that's actually going to be practical, because it's much more expensive and much more difficult to travel to a lot of our places. That's just, nature of the beast. And it's real easy and cheap to get to Las Vegas, and that's our home, so it's easy for us to do the administration there. But this year, it's again going to be in Las Vegas the week of June 8th. Mark your calendar. And we try and make that as easy and as cheap for people to come to as possible. Again, Las Vegas is relatively inexpensive to travel to. Hotel rates are inexpensive, and there's no registration fee for the meeting, and we provide snacks, and we provide just about everything else that you need other than the toiletries and the clothes that you bring in your suitcase. So think about coming and joining us, because that FaceTime and understanding what's happening across the region is invaluable. And that's also a time when we bring together our internal advisory committee. Scott sits on that, and that's mostly the vice presidents for research of our 13 institutions. They're our primary stakeholders, and we take key direction from those folks, and our external advisory committee. And so the people who are supported by CTR-IN funding actually have the opportunity at that meeting to present their research to our external advisory committee, who are really blue ribbon scientists with tremendous expertise, who are all ears to try and understand what you're doing and how they can help you move that next step. And it doesn't just stop at that meeting. There are follow-ups from there to help things move along. Okay, so again, the annual meeting this year is going to be in Las Vegas, starting arrivals on June 7th, which is Sunday, and the main meetings will start probably the afternoon of June 8th and continue most likely through Wednesday. We're still working out the final schedule, but again, that'll be posted on our website. Okay, so what's the current status? What have you done for me lately? So Round 1 pilot grants, this was actually before we even knew that we had a notice of award. We put out a call for applications 2 years ago in May, and we got 24 applications, and of those we awarded 6 pilot grants, and we were ready to push the button to make those awards the day that we got our notice of award, and that's in effect what we did. But we only got 24 applications from 5 of the 11 eligible institutions, and that was not good enough. Again, we're trying to be the rising tide that lifts all ships. So we, again, on the day that we had the notice of award in hand, we already had an RFA prepared. Again, Curtis and Jim were instrumental in having that ready. And we put out another RFA for what we called Round 1A to try and get more proposals. And we got 63 applications in response to that, and awarded another 14 pilot grants, so 20 in the first year. And then we had a second call for pilot grants that almost as the dust had settled with that first round, we put out a call at the end of January last year, and that was for pilot grants that were starting this July for the year from July 1st through June 30th. We got 97 applications in that round and made 15 awards. And for those of you who are interested in data, this is how it plays out in terms of Round 1 applications by schools, Round 1A application by schools, totals, and the total numbers that were funded in that first year cycle. So we had as many as 4 at one institution, and every institution had at least 1 in the first year. Round 2, the RFA was again out the end of January and went through the review process and for funding this current project year. And just as an aside, our project year is 12 months, and this is one of those odd NIH grant mechanisms where we only get a basket of money for 12 months, and it goes away at midnight on June 30th, and it renews at 1 minute after midnight on July 1st. And so our money has to be spent in the 12-month year. The first year, actually, we only got our notice of award on September 15th, so it was a shortened year on top of it. But all of our grants then are grants that have a hard end date on June 30th because that's the way our money comes and goes. So for round 2, we moved the process entirely online. Letters of intent with abstracts were due in March. We got 124 letters of intent. Invitations to submit after we screened, really after Curtis and Bill screened, to be sure that these were translational or clinical. We invited, I think it was 114 to submit, and we received applications by April 25th, did the review through until June. Now our process is we have external scientific reviewers, and then we take those results for science and we present them to our internal advisory committee, again the vice presidents for research, the stakeholders across the region, sitting as our council. So this is the equivalent of NIH council, and they are looking at both science and equity and the overall portfolio that we're going to support. So they make recommendations from there. Those recommendations then go to our external scientific advisory committee for a final pass on whether the science seems appropriate. And then those recommendations finally come to me as PI to decide on which awards we're going to distribute. And I can tell you that so far, there's been no question. We've just gone with those recommendations all the way through. I do have the option to change things if need be for equity or for some other considerations. So the awards were announced at the end of our annual meeting online by our pilot grant portal. And this is what we came out with for year 2. Again, 124 letters of intent. And those of you who are astute will notice that many of the institutions that had been pretty shallow in the first year really came to the plate. And a good deal of that, honestly, was institutions that Jim and I had visited to really explain the program. People had started to understand and realized that they should be getting into this pool. And so we had 97 applications and made 15 awards. Visiting scholars, I mentioned that already, and again, the call for this year closes in about 3 weeks. So if you think you want to put something in, it's not an onerous application. Blakely, sitting up here, has done one, so she can advise you on how to do it. And it's a really good opportunity if you think it would help you in terms of developing a mentoring-mentee relationship or some other career development. Investigator salaries not allowed in Visiting Scholar Awards. Earliest start date this year is going to be March 1st, although if you have some pressing need, you can tell us about it and we might be able to make arrangements sooner. And again, funds have to be expended by June 30th. The application is online, and we're anticipating between 4 and 5 awards for that this year. And last year, the success rate was 100%. 5 out of the 5 applications we got were funded. Mini-Sabbaticals, just again, one call for this year, also closing on November 26th. And I've mentioned already, this is more for mid-career and established investigators, a higher amount of potential funding, up to $20,000 in direct. Again, the earliest start date would be March, but we could negotiate that if necessary. Again, funds have to be expended by June 30th. Now, in terms of calling this a mini sabbatical, again, don't get the wrong idea. This doesn't have to be a classic academic sabbatical. It's just something for a mid-career or more established investigator to develop a relationship. We may need to change that, I think, in order to be a little bit less confusing to people in future years. But again, for that, we're thinking up to 4 awards this year. We've got a budget set aside of $80,000 in direct costs for that. Mini grants, I've mentioned that already, but it's important that you consider just the range of things that mini grants could potentially be used for. And this is not an exhaustive list, but acquisition of pilot data, analysis of existing data with a specific plan to publish would also be fundable with this mechanism. Development, early development of an intervention, development of a community-based collaboration, development of a new collaboration between investigators at 2 or more institutions within the Mountain West Consortium. And again, you might think of other things that are generally in the same domain, and that's all fair game. There's going to be 1 more application deadline for that on January 14th. This application is also entirely online. Up to $10,000 in direct costs plus 10% indirect. Again, investigator salary not allowed in this because it's a small pot. Earliest start date for the first round was December. For the second round will be late February. And we've budgeted $200,000 in this year, so up to 20 of these things will potentially be funded. Round 3 pilot grants. I'm going to turn this over to my colleague Jim Kenyon to talk about this, since he and Curtis have been very involved in the ways that we're continuing to tweak this program to make it more and more responsive.
Okay, thank you. So round 3 mini pilot grants. As I like to say, the issue with pilot grants, as Bob mentioned, was something we wanted to get going very, very quickly. On September 13th of 2013, this program didn't exist. And on September 14th, 2013, we had $4 million to get moving. And so with Curtis's help, as Bob mentioned, we got our round 1 pilot grants going that very day. As we're coming up now, and you can see a timeline on the board, we're now doing this for the 4th time, and we are managing to refine this program. And one of the things that we're starting to do as we push forward this program is, back in 2013, kind of the entryway to the CTR-IN in many cases was through the pilot grant program. I'm now going around encouraging people to enter the program through our mentoring program, through our biostats program, to get your background organized, to do a mini sabbatical, do a visiting scholarship, to again prepare to turn in and prepare a higher quality pilot grant proposal. And so there are a couple of changes that are important for this. We're working right now, and we'll be doing this before Bob and I leave town with Curtis, to get the funding announcement organized, to release the funding RFA later this month to get this organized. We, in part, were swamped last time. I'm the guy that needs to recruit reviewers for the 100 grant proposals or so we get. Been very fortunate, tremendous cooperation from external reviewers, people at institutions that are not eligible for pilot grants. Been very, very helpful to do that. And what we would like to do moving forward is to reduce the number of applications per institution to 4 applications. This will get us in the neighborhood of 50 applications, where I think we can get higher quality, more reviews. I think we're going to improve the review process tremendously by reducing the number of applications that come in. For most of our institutions, limiting to 4 applications will not be a big hit. The big hit is mainly to, appropriately enough, the University of Nevada in Reno, the University of Nevada in Las Vegas, who swamped our system with almost half of the pilot grant proposals that we were reviewing. So don't tell my VPR or his VPR that we're doing this, because they're the guys that are going to have to be doing the hard work about this. We're going to ask for what we call nominating packets from your Vice President for Research to come in to identify the up to 4 applicants that the University of Montana will be submitting to us. This will give us a chance to identify them as either clinical or translational. An important component of this is we are limited in our ability to fund. Research must be clinical or translational. This will be by the NIH definition. I want to point out very clearly that clinical research is research that involves an identified human being. So that if you have an identified human being and you suggest they don't eat so many donuts, see what their weight outcome is, that's clinical research. It does not mean you're wearing a white coat drawing blood from somebody in a clinic. Clinical research as defined by the NIH. Similarly, for translational research, involves a sample or something from an identified human being. So we will review these to see that they are clinical or translational, and then, and this will be early in next year. Applications for the proposals are due in March of 2015. We will send those out for external review and get the reviews back. Process very much as Bob has summarized. Let's get the process through our internal advisory committee and our external advisory committee for announcement right around the June meeting in Las Vegas. Again, earliest start date is July 1st. Important component of this is, as in INBRACE and COBRACE, all of these proposals must go to NIGMS. They will work their wonders on them, taking either 3 to 6 or 8 weeks. They will be looking at your planned enrollment tables. They'll be looking at your IRB protocols. They will be looking at your budget. And when everything is all fine, then we will get permission to issue a subcontract to the University of Montana. So very important at these earliest stages to get that information organized and get them into us. Recommend very strongly contact the mentoring educational key component activity for support there, getting your IRB organized, getting your budget organized, because it's a very important component. You can't start spending until we get all that in place. So the earliest start date will be the 1st of July. You'll have roughly 365 days to get invoices to spend the funds. On 6/30/16, funding on the project must stop. The process, and kudos to Janusz in Las Vegas, Bob Langer recruited this individual. Our website, and you're going to talk about our website in just a few seconds, super website to submit all of these issues. So your first call is Judy Friedenberg, your concierge. I don't know, is she here at the moment? She is our main contact through her to the CTR-IN. So questions can be directed to her. We are counting on her to deliver information from us to you. Then Solomon Harar is our feet on the ground, although he's apparently in Kentucky, biostatistician. So he is accessible by Skype and also through our website. Contacting these individuals as you prepare any of your grant applications for us will be very, very, very helpful, and we encourage you to do that. Okay. So, contact your local biostatistician. So the senior leadership, and I think we're running late on time. I'm just going to leave this up because we'll get Bob going into the website.
Okay, so our website, real intuitive to find. It's ctrin.unlv.edu. And there it is. I don't know if you can make that out up there. But just remember our name, .unlv.edu. And the website is pretty robust, but it's sometimes hard, unless you've seen a website, to understand how to begin to navigate it. So I want to give you, in like 3 minutes, just some pointers of how to find things on the website. So we've got our welcome message and all that other sort of stuff. Latest news is where we typically will put information about RFAs that are currently out. I'm talking about our site visits now, new pilot grants, annual meeting, mini grants. Now, RFAs, where the money is, drop-down menu at the top here. So it starts out with pilot grants. Currently, there's not an active RFA for pilot grants, but you can go and see, just to get a sense of what pilot grants are like, a list of pilot grants awarded. And you will find up here Blakely's pilot grant from round 1. She's right up there. And just get a sense of the range of pilot grants. And one of the things that's also been extraordinary about the way that this has developed is we were fearful initially about how much of a range we were going to get between translational and clinical. Even in the first year, the first 20, we got the whole gamut from true translational just off the bench all the way out to very extensive community-based participatory research. So the whole gamut, and that's continued through, which is really a tribute to the region and to the range of expertise that we have here. But RFAs, again, visiting scholar RFA is there, the mini-sabbatical RFA is there, the mini-grants RFA is there. You've got links on each of these pages to the other resources that are relevant to applying to these grants. You've got links to the application portal to apply for these grants. Also, where there are registration needs on our website, we've designed it such that once you register, you have that same registration carried through all across all parts of the website. So if you register to submit a mini grant or a pilot grant, that same registration will carry through when you go to our educational portal and want to have some information or take a course there. Now, our portals are mostly, well, let me go back up here one more time. So next on the drop-down menu are drop-downs that have sub-menus for each of our key component activities, and you can look at the range, really the depth of activities in each of our KCAs. You can get information on the partner institutions, information on our annual meeting, information on the background Mountain West Research Consortium. Over here on the right side are all of our portals. And so we've got application portals for the pilot grant, for visiting scholars, for mini-sabbaticals, for mini-grants. So as an example, since a mini-grant RFA is currently active again, if you go here, you can go to that tab and you can either sign up as a new user or you can log in and continue working on an application that you may have in process. If we go back to the main website here and we look at education, so here's our education portal, and up here we have a certificate program now on grantsmanship. We have short courses. And with each of these things, there's also contacts and help contacts that you can get to. So if we go back home. Oh, something else that's, well, let me take you back there from the main website. Okay, so if you want to find out who's your concierge, over here on the right, the concierge network, we have a list including phone numbers and emails, and so You can also, where was I? Okay. So you can see who on our external advisory committee. This slide presentation that we use today is here. You can either download it or you can view it on your screen whenever you want. So I should have told you that at the beginning. You didn't even have to take notes, but it's probably better that you did because now you'll have learned it. But the whole slide presentation is up there. And here, mentor or collaborator search, just above that picture. Here's where you can find Vivo and potentially do the keyword search in order to find an investigator. So if you go to that link, coming real soon now. I don't know, maybe this is a blocked website for. Let's try it again. Yeah. Okay, well, if it doesn't come up, it comes up, and the first thing that's front and center on the screen is a search box. And I was going to show you, we put in obesity or physical activity, for example. You'll get probably about 40 hits already across the region. And you can follow those through Vivo profiles then and start to narrow down people who may be potential collaborators for the kind of work that you want to do. Okay, so let me stop there. We're just about at the end of the hour, and see if there are any questions for Jim or for me.
Can you talk a little bit about your thinking about renewals of proposals and your decision to maybe fund for 1 year and where that's coming from?
Okay, yeah, it's a really good question. So in this most recent round for the second year, we did allow competing renewal proposals, but they were competing and they competed in the same pool as the new proposals. And had they made the cut in terms of scientific merit, they would have been funded. Now, there's another wrinkle in here that's also important to mention. We discovered late, we'd not been told this initially, that the IDEA program will only fund one research activity per investigator at any given time. You can't have research funding support from IDEA sources, from an INBRE, from a COBRE, from CTR, from more than one at one time. You can have academic enhancement support together with research support. So for example, you can be both a pilot grant investigator or mini grant investigator and have a visiting scholar award or mini-sabbatical award at the same time. But you can't have both. So we did actually have two competing renewals that made the cut in terms of science in this second year that actually were also online for getting other IDEA support, and we offered them the option of which one they would take. And they both took other things, so we had more money in the CTR pool to go to next ones down. But that's the way that it will work. So we will allow competing proposals, but they won't be in a separate category. They are in the same pool for scientific merit as everything else that we receive in a cycle. Does that answer the question?
I was thinking a little bit more to hear about your logic behind that, given that most proposals that reach our stage will need multi-year support to develop into our proposal, or maybe you don't think so. I guess that was what I was really thinking.
Yeah, so that's also really interesting in that we now have a group of the national CTR PIs that meet monthly. And we've discussed philosophical things like that in that group. And the first two CTRs actually, in their first pilot grants, had a range of times that they would support it or they would allow renewals. They both, after their early experience with that, decided not to continue the practice, to limit their pilot grants to just 1 year, because they thought that what they were seeing happening was that people were getting a little bit sloppy with their deadlines and not actually finishing things as they had intended, and they were using the opportunity for further support to just extend their timelines. They didn't think that was a good investment of their relatively limited resources. We haven't had that experience yet, so I honestly can't say how that would play out in our region. But the philosophy overall is to try to support as many people, plant as many seeds as we can, and then potentially to provide support if you don't compete successfully for a renewal on the full pilot grant level, to allow continued support through a mini grant, through a visiting scholar, through a mini sabbatical, or just access to our core resources, editing, biostat support, mock study section, things like that. Yeah. Other questions?
On the pilot projects, if it's a collaborative effort on a pilot project, do all of the investigators have to be within the Mountain West Consortium or in IDA eligible states? What's the criteria?
Good question. So we prefer collaborations within the Mountain West just because, you know, we have so little money here anyway. We want to grow everything we can here, but we realize that sometimes you can't find the expertise that you need. So we do allow collaborations outside of the Mountain West. The wrinkle is that we can't provide salary support for somebody outside of an IDEA state. We can fund them as a consultant or in other fee-for-service kinds of arrangements, but the IDEA program can't provide salary support for somebody in a non-IDEA state. Oh, and there's one other wrinkle in there that we also tripped on that we learn as we go. International support is yet another issue. So we had 2 pilots this past round who had substantial Canadian collaborations. And it turns out that the rule of thumb at NIGMS is that you can't have more than 25%, or you can't have more than 24% of funds going outside of the country, even Canada. So, you know, that was an issue, and we had to have those budgets redone. Other questions? Thank you all. And again, look at our website, and do not hesitate anytime to contact Jim, me, or the rest of the folks on there if you have questions or just suggestions for us to do things better.